I spent a year in Botswana in their max security prison. My first day walking in stood in such sharp contrast to my experiences in North Carolina. It was an open courtyard. There's actually music playing. And as I spent more and more time there, what I started realizing is we have just constructed our carceral systems in ways that are highly punitive and highly extreme. It just set my career trajectory in a different pathway. So I grew up in Houston, Texas, and grew up with a sister who's a year, a month, and a day younger than me. My parents are both scientists. My mom's a chemist. My dad was a biochemist. What was tough about that, I mean, there was so much joy kind of in our growing up, but my dad was diagnosed with colon cancer when I was young, when I was 5. Much of my young childhood was not totally defined by that, but really shaped by his experiences with physicians, with the cancer center. He worked at MD Anderson and also was a patient there. Both my sister and I ended up becoming physicians, but I was committed to it from a very early age. Yeah. A friend of mine who was working in a prison education program, we started talking about kind of the deep racial disparities in the death penalty. And it was something that kind of really shook me up. It caught me off guard. But I was really interested about what I had learned in this late night conversation, and cold wrote a few local prisons and the North Carolina Correction Institute for Women. The warden wrote me back immediately. And so a cohort, a dear friend of mine, Ambi Yesus, and I and others designed a class 8 weeks where we started meeting in the evenings. And there were women exactly our same age. I think that's why I root myself in those early days at Duke in medical school. I was in community with, one of my closest friends still to date, Ambi, but also another group of medical students that were deeply committed, really curious, humble about kind of who we are, what we had to offer, and excited to learn from the women who are incarcerated. And it's the space that was created at Duke, but also behind bars. So I was at the University of California, San Francisco for residency and spoke to large groups of people that had just come home, focus groups of individuals that were incarcerated, healthcare providers, trying to see kind of what are the key components of a program that you'd want to see to help with the transition of care. We did exactly that in partnership with community organizations that are robust civil rights organizations in San Francisco that are led by people with histories of incarceration, hired a first community health worker, a co-resident, Clemens and Wang did that, and started seeing patients immediately. So within 2 weeks of release, ended up studying this in a randomized trial, trying to bring forward the best evidence to say, hey, we think that this makes sense, this program makes sense. The program has grown to 48 programs across the country, so it's been incredibly exciting. It's a real joy to see how it is that science, again, in partnership with people that have been incarcerated, can build a network and build the evidence base for how it is that we ought to be transitioning care for people that are coming home. So in 2020, I was able to launch this new center, this SAGE Center for Health and Justice. It's a partnership between the School of Medicine and the Yale Law School, and it's really anchored on how it is that we end mass incarceration, especially trying to leverage assets of the health systems and the assets of people that have histories of incarceration. Core of our work is still kind of in the delivery of clinical care, so it's in Transitions Clinic. I still see patients every Friday that have just come home from prisons and jails, and it's in these kind of clinical settings that with our patients, with their family members, start thinking about what are the questions that we ought to be asking in our research program. There's nothing I think more compelling than getting yourself out of your comfort zone. You know, I had never stepped foot into a prison. I was really curious about it because a close friend had had this conversation, had taken the time to really kind of school me in something that I'd never been schooled in before. The not letting it drop and then taking it to the next step. I stepped foot into a prison and jail. I stepped foot with one of my closest friends into a prison, and that's changed the trajectory of my career. If there were ever a truer thing, I think that that's it, is like to surround yourself, your family, your kids with adults that love on them. And for me, this included from early on, my mom, my husband's mom and dad who are with us, my sister who lives down the block from me. If without them, there would be no part of this career that I could have. I share kind of all these successes with them.